Welcome everyone. It's a great pleasure to have you join us for the Acts 2 workshop, state and federally funded programs for Floridians with dementia and their family caregivers, what to know and ask. I'm Dr. Robert Glukov, servant leader of the Acts 2 project and professor, Florida State University College of Medicine. If you haven't heard the term Acts 2, it stands for African American Alzheimer's Caregiver Training and Support Project 2. I hope and pray this evening that you will find this workshop both rewarding and highly informative. Before I introduce this evening's presenters, I want to recognize our partners who have contributed both resources and guidance in the development of the Acts 2 Dementia Caregiver Workshop series. Acts 2's primary collaborators are the 11th Episcopal District, African Methodist Episcopal Church, the Florida State Primitive Baptist Convention, the Florida Progressive Missionary and Educational Baptist Convention, the Florida General Baptist Convention, the Florida Department of Elder Affairs, and the FSU College of Medicine REACH Project. Turning now to tonight's presenters, we have four exciting speakers: Mrs. Lisa Bretz, Mrs. Marissa Henderson, Ms. Dwan Clayton, and Mrs. Tamika Norton Brown. I have the distinct privilege of serving as moderator for this evening's workshop. Permit me, folks, to share a few words about each of our presenters. Our first presenter, Lisa Bretz, is Executive Director of the Area Agency for North Florida, now doing business as Advantage Aging Solutions. She is responsible for the coordination of programs and services for elders across 14 counties in the Florida Eastern Panhandle region. Lisa received her master's in social work degree from Florida State University. She has been working in the nonprofit sector for approximately 25 years. In addition to her role as Executive Director of Advantage Aging Solutions, Lisa serves on the Board of Trustees for the Florida's Council on Aging and is Vice President of the Florida Association of Area Agencies on Aging. Note that Lisa was primary caregiver for her dear mother with early onset Alzheimer's. She created the Cheryl's Hope Project in her memory and honor. In her limited spare time, Lisa enjoys family outings, weekly Bible study, and drinking nutritious coffee beverages. Our second presenter, Marissa Henderson, is Director of the Aging and Disability Resource Center in association with Advantage Aging Solutions. She is responsible for the oversight of Medicaid administrative activities at the agency. One of her key roles is to assist older adults with the screening process for home and community-based services. Marissa received her master's in social work degree from FAMU in 2001. She has 20 years of experience as a social worker, including mental health counseling, Meals on Wheels management, and homeless shelter supervision. Marissa loves the Lord, and though she serves in the community, she enjoys being a youth leader in her church and spending time with her dear 3-year-old granddaughter, Amora. Our third presenter, Dwan Clayton, is Memory Disorder Clinic Coordinator at Palm Beach Neuroscience Institute in West Palm Beach, Florida. She runs the clinic's day-to-day operations in association with the medical director, Dr. Reef Dalvi. Dwan is a seasoned social worker with over 15 years of experience in Palm Beach County. She has worked in community-based care, focusing on child welfare, mental health, domestic violence, and Alzheimer's disease and related dementias. Dwan is service-focused, highly enthusiastic, as you will see, and goal-oriented with a passion for helping others excel, and being an advocate for change in the community. Outside of work, she enjoys listening to music and spending quality time with her two children and family. Last, Tamika Norton Brown is coordinator of the Acts 2 project. She has worked in the area of survey development and evaluation for the past 21 years. She has served as a caregiver for her dear aunt and uncle with dementia and has a passion for helping others. Tamika has a wellspring, a wellspring of support for hundreds of family caregivers of older adults with dementia across the state. She is also a strong leader in her faith community, a leader by example. Folks, during the course of the workshop this evening, I encourage you to share questions to be answered at the end of each presentation using the text message function of Facebook Live. We will also have a 10-minute question and answer period at the end of the fourth presentation. And now we have Lisa Bretz joining us for her discussion on services across the state for older adults. Thank you, Lisa, and welcome.
Thank you, Dr. Glukoff.
We are so blessed to have you. We are so thankful to have you this evening, and we're looking forward to your presentation.
Thank you. I wanted to share with you tonight a brief overview of programs that our agency administers across the state. Actually, I have 14 counties. I have 11. There are 11 total area agencies on aging in the state. So I have 10 colleagues around the state that offer the same types of services that we do. We are fortunate to be funded by the Department of Elder Affairs, and we are very pleased and honored to be funded through the legislative process of both Florida and at the federal level through what our first program is, the Older Americans Act. I wanted to go ahead and just give you a brief overview of some of the services that you might be able to access by reaching out to one of the Aging and Disability Resource Centers that are operated through your area agency on aging. So I don't want to get into the federally and the state funded. That's not my focus. I just want to share program information with you. We can talk funding sources anytime. The Older Americans Act was established in 1965 at the federal level to recognize the contributions that older Americans have made to their communities and in their lives, contributing to the economy, raising their families, just being really great citizens. And we all know elders just offer us a wealth of knowledge, experience, and true history. So to honor them, the Older Americans Act was created. The Older Americans Act also established that there would be a state unit on aging in each state. Ours is the Florida Department of Elder Affairs, and that they would designate area agencies on aging for their community care service areas. I am representing Planning and Service Area 2, and we've been in business since 1978 to oversee programs. We offer emergency home energy assistance to individuals 60 years of age and older. We also provide free and unbiased health insurance for Medicare beneficiaries through the Serving Health Insurance Needs of Elders volunteer-based program. And it's an exceptional program. It's a SHIP program that for Florida, and this type of program is replicated throughout the nation. We also have the statewide Medicaid managed long-term care program we're part of the network and connecting people to this program. And Marissa's going to talk to you a little bit more in depth about this program in just a bit. So the purpose of the Older Americans Act is to provide access to services and supportive services to individuals 60 years of age and older. That is the only qualifier. You have to be 60 years of age or older to receive the services. You'll see some of the services that we provide are coordinating transportation. We have recreation at meal sites. Congregate dining is one of the most wonderful programs that are covered under the Older Americans Act. And then home delivered meals I know all of you have at least heard the term Meals on Wheels, and that's directly in line with a service provided under the Older Americans Act. We have health and wellness programs of evidence-based nature that we offer throughout our planning and service area. And the National Family Caregiver Support Program, that was one of the last initiatives that President Clayton signed into law prior to his finishing up his term as president. And that program allows us to provide a breadth of services for individuals who are in caregiving situations. And then we also offer elder abuse prevention and awareness education. We are offering free presentations to organizations and to make sure elders are aware of their rights. State-funded programs, again, through the blessing of our Florida State Legislature, we have community care for the elderly, home care for the elderly, and the Alzheimer's Disease Initiative. And so I'll share a little bit about each of those programs with you. For community care for the elderly, to receive services, you must be at least 60 years of age and older. We are looking for individuals who are functionally impaired, either through their activities of daily living or instrumental activities of daily living. And an individual's, why the functional impairment matters is because that's going to drive where an individual ends up in priority for receiving these services. And there may be a copay assessed for individuals participating in the community care for the elderly. The purpose is to help functionally impaired older adults live dignified and independent lives in their own communities. We provide a variety of home and community-based services to eligible consumers. So the caveat is there is an assessment process to accessing all of these programs. And again, Marissa will be talking more about our assessment processes. The Alzheimer's Disease Initiative, area agencies on aging administer a component of the Alzheimer's Disease Initiative, and I'll be thrilled for you to hear more about what the Alzheimer's Disease Initiative offers when Ms. Dwan presents. At the area agency, we are working with providers to help connect individuals who have a diagnosis or suspected diagnosis to supportive services within their home. There's often a caregiver who needs respite. Respite is taking a break. So we are looking to provide that type of service through this program. For eligibility purposes, an individual can be considered if they're 18 years of age or older with that diagnosis or suspected diagnosis. There has to be somebody that we would be providing respite to. So we are looking for a primary caregiver who may live with the individual or may be partially responsible for a portion of the day to oversee the supervision and safety of that loved one. And again, there may be a copay assessed for this program. I do want to share that when we talk copay, I know people are like, I can't afford anything. I can't afford a copay. Don't think of copay in these programs as you would with a physician's office copay. We're not talking $40 for a visit. We're not talking $25 for a visit. There is a scale that an individual's assessed on, and the copayment is based on an ability to pay. So although copay may be assessed, you may not be able to pay it. And our case managers that we contract with would be able to help you through that process. The purpose of the Alzheimer's Disease Initiative is primarily to help provide training and support to care partners, unpaid caregivers, or individuals with Alzheimer's disease and, those caregivers of individuals living with Alzheimer's or related dementia. Home care for the elderly. Eligibility is the individual has to be 60 years of age and older. They also must be functionally impaired and require continual supervision. That means somebody has to be living in the home and be with that individual 24 hours a day. Caregiving can be assigned to someone else. For example, if the caregiver works and they have somebody else stay with their loved one during the day, they can assign the benefits of this program to that individual. There is this monthly stipend. So I know we have individuals that are looking for payments for caregivers. And unfortunately, those programs that we would like to see be able to replace income for individuals who have to give up their jobs, those programs just are not available. This program provides a basic subsidy, is what we call it, of an average of about $160 a month. And that can help pay for an electric bill, groceries, gas, anything that caregiver feels that money needs to be used for. So there's no restrictions on how that money is expended. It's under, we assume that stipend is going to be beneficial to helping that caregiver take care of something that another financial source cannot. So how do you access these programs? Easy peasy throughout the state. We have the same phone number. If you call 1-800-963-5337, you're going to reach our elder helpline. You can also remember 1-800-96-ELDER to be connected to an information and referral specialist that will walk you through the system that we have in place to help individuals age in place with dignity in the home of their setting, in their choosing.
Thank you so much, Lisa. Very, very thoughtful presentation. If we don't have any questions, if we do, just flash them across the screen. If not, I have a question. What are the initial processes after you've made that contact with the Elder Helpline in speaking with representatives from the Area Agency on Aging? Could you give us a typical scenario?
Sure. We might have somebody calling, and this is, an everyday occurrence. I'm looking for services for my mom. She's struggling with keeping up with her home. She doesn't want to go into a nursing home. Are there any types of services available to help her? Well, we're going to spend time talking to people to make sure they realize nursing home is an option. It is the last option. And it generally is going to be recommended if skilled care is needed. These individuals that we're serving through our programs don't need skilled care. They just need a little bit of help. They can no longer bend and move around safely in their home to conduct cleaning and vacuuming, washing dishes, doing laundry. So we're going to take time to hear what exactly is mom's situation, what supports does she have versus what does she need, navigate through the system for her, put things into our terminology so that we know what we would be referring them to within the community, whether that be our state-funded programs, our federally funded Older American Act program, a program that Marissa's going to talk about, or private pay programs.
Thank you. Any tips, Lisa? Just one more question. For caregivers who may be calling you for services for themselves or for their loved ones with dementia, how much of a wait time, how much how long does the process take for them to get into the programs that may be helpful to them? Any tips?
So, tips are, don't let wait list make you not want to go through the process. The wait list is managed by priority. So even if you go on a wait list this month, you could be the highest priority individual screened and be ready to be activated for services the next month. But I have 14 counties. Some have longer wait lists than others. So really, I honestly cannot give you an estimation. I can tell you that it's based on priority that is assessed through a formal assessment tool.
And would that be true across the state of Florida for others?
It is.
Yeah, thank you. Just wanted to thank Dr. Doris Richard, and I think there was one other person who made a positive confirmation. Thank you, Dr. Richard, and thank you, Jackie Alexander, for your positive feedback. And now we have Marissa Henderson, who is the director of the Aging and Disability Resource Center associated with Advantage Aging Solutions. Welcome, Marissa.
Thank you. I'm happy to be here. Okay. Good afternoon, everyone. I'm so happy to be here. My boss, Ms. Lisa Bretz, was just with us a moment ago, and she spoke about many of the programs that we have available at our agency. I'm just going to talk to you about one program and our process that the steps that you can take to get on the waiting list that she just spoke of, and the process that the screeners do when you call in and you're trying to receive the services. So the statewide Medicaid managed care long-term care program is a federal and state funded program. It is also referred to, a lot of people call it the Medicaid waiver or the Medicaid long-term care program. Now, this program provides home and community-based services, and it will benefit people with dementia like yourselves and caregivers. And with this program, you will receive full Medicaid. Well, the client receives full Medicaid, and as well as the home and community-based services in the least restrictive setting. As Lisa was talking, you can receive it in a nursing facility, but we would rather you receive it in home or an assisted living facility, which is the least restrictive setting. So some of the services that will benefit you guys would be, I know a lot of you are really tired, when dealing with your person who has dementia and you need that respite care, the home delivered meals. Even if you're living with someone and you're able to cook for that person, they can still receive the home delivered meals, that caregiver training, the adult daycare healthcare program where you can drop your loved one off and you can have some time for yourself, the case management where you need to coordinate those services, the homemaker, when someone needs to be cleaned up after, and those personal care services are some of the services that I highlighted tonight. Personal care would be when you need someone to come in and assist that person with the bathing and dressing and things like that. Maybe the caregiver is elderly, just as the person with dementia, and they're not able to lift that person into the bathtub, then they can get someone to come in and do that personal care service for them. Now, this particular program has specific criteria for eligibility. So I'm just going to go through the stringent criteria for this program. And then afterwards, I'm going to let you all know how you can access the program and all about the Aging and Disability Resource Center. So first off, the eligibility, you have to be 65 or older, or you can be 18 or older with Social Security disability benefits, or you can be 18 or older with a diagnosis of adult cystic fibrosis. And you need to be living in the community or an assisted living facility or a skilled nursing facility. Now, you must meet medical and financial eligibility. So what that means is someone has to have Medicaid, be Medicaid eligible, and you must have some impairments. So you must meet the nursing home level of care from the Department of Elder Affairs CARES unit. So that just means that your doctor will fill out a form for you saying that you're needing the in-home care, and you need to have some functional impairments with your activities of daily living, like you need to have to be needing assistance with bathing, dressing, eating, or toileting. And the financial eligibility, you need to be eligible for the Medicaid with the state of Florida. And so what that means is your gross monthly income limit for this program is you have to be making less than $2,382 a month for an individual. And this amount does change every year. It normally gets just a tiny bit higher just based on like with the Social Security amounts increase. And then there's an asset limit, which needs to be less than $2,000. Now, that does not include one house and one car or the homestead property that the house is on. It also allows for $2,500 in designated burial assets as well. And you have to give full financial disclosure to the Florida Department of Children and Families when you do the Medicaid application. Now, I know you all wanted to ask Lisa earlier, how do you access these programs? You are going to access the programs through our department, which is the Elder Helpline, which is also the Aging and Disability Resource Center. And it's that one number you call, that 1-800-96-ELDER number. Now, when you call that number, you will get a warm voice with our information and referral specialists. We have 3 specialists on staff, and they are just as nice and kind as they can be. What they do is they gather your demographic information and they talk to the client and or caregiver and see what they're needing and provide community resources and private pay referrals if needed, as Lisa said. And so what happens is that information and referral specialist will refer the caregiver or client over to my department, which is the ADRC, the Aging and Disability Resource Center, and for one of my counselors to complete a telephone screening. Now, one of our counselors will do that within 3 business days of receiving the referral. So in my department, there are 7 counselors in my department. And so we have been specially trained to talk with the client and caregiver and do a telephone screening assessment tool. It's a tool that was made up by the Department of Elder Affairs, and it gathers information about the activities of daily living. So what will happen is my department will be asking questions over the telephone about, is the client able to bathe themselves? Are they able to dress themselves? How are they doing with toileting and eating? Are they having to be fed? Is the food having to be cut up and things like that? So once they gather that information with the screening tool, it's entered into our the Department of Elder Affairs database, and the client is entered onto the waiting list that they qualify for. So the waiting list process. The client's placement on the waiting list is determined by the answers on the telephone assessment tool. So what happens is it looks at the activities of daily living, as I said, and it goes by the need versus have and the caregiver's stress level. So I know many of the caregivers of the clients with dementia are under a lot of stress, and they may be, have ailments themselves where they're not really able to caregive for the person with dementia. So what happens is on the screening tool, it takes into account that caregiver's stress level. It takes into account, what the ailments are of the client with the activities of daily living. And that is how it's prioritized. It's prioritized score-wise, and the computer automatically does generate that client onto the waiting list. So if someone is bedridden and someone else is not, then the person that is bedridden will go higher on the list than that person that is not bedridden. Now, clients are released from the waiting list on a monthly basis as long as funding is available, and their frailty is how they are highest on the list, as I was just talking about. So the wait list release. So once a month, we do have a wait list release. And so after the person is released on the from the list, then what happens is our screeners, the person who did the telephone screening, we do help that client apply for the actual long-term care program. So we'll contact that doctor's office to secure that 5000-3008 medical certification form from the doctor's office for that client. And that's that form that's telling us that client, the doctor is saying that client is eligible for services. And then once that form is received, oh, I'm sorry, can you go back to that slide? Once that form is received, then the Department of Elder Affairs Cares Unit will contact that client and do the level of care for them. Now, the financial eligibility. Our counselors will also help with submitting the Medicaid application and request for additional benefits to the DCF office for Medicaid, and that's a 30-day time frame for that. We also assist the client in gathering bank statements and insurance statements, retirement statements for that Medicaid application. Okay, now the application process is complete after the level of care is received from the Department of Elder Affairs Cares Unit and the full Medicaid benefits are received. And then the client will contact the enrollment broker to choose a managed care organization to serve, to provide their services. Now, once an individual is enrolled in the long-term care program, they'll receive a care manager from the managed care organization, and they'll no longer be under our auspice at that time. And after that, the client will begin services on the month following their eligibility. And then they have 120 days to switch their plan. There's 4 plans that are available under the long-term care program. There's the 4 managed care organizations that they can choose from. And they have 120 days to change that plan if they're not happy with it. Okay, now the ADRC also assists with complaint and grievance assistance, re-eligibility assistance if the person loses their benefits through the long-term care program. And we also do community outreach, just as I'm doing tonight. And so we have one number that you call when you want to receive any of these services and programs. You're going to call that 1-800-96-ELDER number, which is the Elder Helpline. You'll reach our ADRC department for Advantage Aging Solutions. Thank you very much.
Thank you so much, Ms. Henderson. That was an excellent presentation. We do have some questions for you. If you want, here, this is from Chanda Bacon. I'm a caregiver to my mom, Mrs. Henderson. She doesn't have Medicaid. Can we receive the services about which you spoke?
Absolutely. What happens is you don't have to have Medicaid when you apply with us. You just have to be eligible. So those income and asset guidelines, you know, her income would need to be less than the $23.82 a month, and the assets need to be less than $2,000. And we can assist the person in applying.
Do we have another question or to ask Mrs. Henderson? Is there a minimal criterion for making the ADL requirement? Activities of daily living impairment requirement?
No, there's not a minimal requirement. Now, just as I said, those who are worse off with the ADLs, they'll go up higher on the list, but there's not a minimal requirement for that.
And with activities of daily living, are we referring to activities such as bathing and eating? Can you elaborate?
Yes. So if someone is needing assistance in and out of the bathtub, the screening tool will go by how much assistance they need. So some people may only need supervision with that, somebody to just prompt them or tell them to go take a bath. Some people might need a physical hands-on help into the bathtub. So those who need the hands-on help will go up, you know, they'll obviously score higher than those who only need the supervision.
And one other quickie question. If I were someone who was wondering that I'm on the border of meeting the annual monthly income requirement, how do I get help in sorting out the ins and outs of meeting that requirement?
Now, we can refer people over to the legal services to help them. There are some people who do qualify if they do a qualified income trust. And so that's a possibility. You still may qualify if you're just over the income limit.
And do you have legal consultants at the Aging and Disability Resource Center, or are those obtained privately?
We'll have to refer them out. I think we do partner with Legal Services of North Florida.
Would that be the case across other area agencies on aging, that they go to legal aid as well?
I'm not sure, but I'm probably sure that's the case, though.
Well, thank you very much, Mrs. Henderson. That was really an outstanding presentation, and we look forward to the panel discussion to ask more questions after Tamika Norton Brown's presentation.
Okay, thank you.
And next we have Miss Dwan Clayton talking about what memory disorder clinics that are funded by the state or partially funded have to offer the community. Welcome, Dwan.
Thank you. Thank you, Dr. G, and thank you for the Acts 2 project for allowing me to come and present what I like to say is Florida's best secret, the memory disorder clinics. As Dr. G stated, my name is Dwan Clayton. I'm a medical social worker, and I'm the clinic coordinator at the Memory Disorder Clinic located at Palm Beach Neuroscience Institute. So a brief history. In 1985, the state government recognized the continued growth of our older population and the increased rates of Alzheimer's disease and related dementias. The Alzheimer's Disease Initiative was created, and it is housed under the Department of Elder Affairs. The ADI provides specialized services to meet the needs of caregivers and individuals. Melissa and Lisa talked about a little of those services, which include respite care, caregiver training and support, education and counseling services, and case management. Studies have shown that an active management of ADRD can improve the quality of life of affected individuals and their caregivers. As we age, age is the primary risk factor for memory and cognitive impairments in older adults. In the state of Florida, there are just over 580,000 Floridians currently living with Alzheimer's disease alone. That does not include the people that have not been diagnosed or individuals living with other dementias such as Lewy body dementia, vascular dementia, and Parkinson's dementia, just to name a few. Currently, Florida ranks as the state with the second highest number of people diagnosed with the disease in the nation. We are second to California. You can go back a slide. Alzheimer's disease is the sixth leading cause of death in our country, and in our state, it is the only top 10 leading cause of death without any known prevention, treatment, or cure. Next slide, please. So, two of the greatest components of the ADI is the creation of the memory disorder clinics and the brain bank. Back in 1985, when the memory disorder clinics were created, it was 15. Now we've grown to 17 across the state. We're located, next slide, please. We're located at medical schools, teaching hospitals, public, private, and not-for-profit hospitals. And the MDC that I work at is the only MDC in the state that is located in an outpatient neurology office. Next, please. So here is the state of Florida. And as you can see, the memory disorder clinics are located all the way up to the Panhandle, all the way down through Miami-Dade County. We have them in Tallahassee, Pensacola. There are two in Orlando. In my county, Palm Beach County, we have two providers, FAU and myself, but 3 different locations in West Palm Beach, Boynton Beach, and Boca Raton. Miami-Dade County actually has 3 locations, the University of Miami, Mount Sinai Medical Center, and also Miami Jewish Health. Next slide, please. So what's the goals of the Memory Disorder Clinic? We're here to provide comprehensive assessments, diagnosis services, and treatments. But what exactly does that mean? We provide an array of different services. Next slide, please. Some of our services do include memory screenings. Memory screenings is a big part of what we do, especially in the community. We administer either using the Montreal Cognitive Assessment or the MMSC. We provide a lot of community education, such as this, and pre-COVID, we used to go out into the community. We follow up on silver alerts. I know everyone has seen the silver alerts that come across either your phone or as you're driving on the highways. The Memory Disorder Clinics follow up with those. We contact the high-risk individuals and their families, do an assessment to see if services are needed. We provide driving evaluations and assessments. We administer driving questionnaires that can assess whether a patient is still eligible to drive. And a few of our clinics actually use a formal driving evaluation called Drive Able. We facilitate case plan meetings. This is very unique to the memory disorder clinics. It is a comprehensive team meeting that includes the family, the patient, any support system that they may have, and we address all aspects from disease education, caregiver needs, activities of daily living, placement, if that is something that the family is looking for, financial assessment, safety, all the way to end-of-life issues. We provide a lot of resources and definitely a lot of referrals. We do support groups in our clinics. We are certified to provide the 1 and 3 hour ADRD curriculum, and a lot of our education outside of the community. We also educate caregivers, respite service providers, law enforcement, and we also co-facilitate the Dementia Care and Cure Initiative Task Force in our different counties. So you may be asking, next slide, please. Why should I contact the Memory Disorder Clinic? Next, please. We are a multidisciplinary team consisting of neurologists, neuropsychologists, nurse practitioners, clinical social workers. One of the unique designs of the Memory Disorder Clinic is having a medical social worker on the team. The medical doctors are always looking at medical. Our clinical social workers are looking at everything else besides medical. The benefit of coming into the Memory Disorder Clinic is if your loved one is diagnosed with Alzheimer's or another dementia, and they go home and they're like, okay, now what? What do I do? Well, the clinical social worker, such as myself, is there with your family to help process the diagnosis and to also look at the different services and different things that may need to get put in place now due to the diagnosis. Next slide. So it's good for everyone to know that as we age, we may experience some slowing down of thought processing and short-term memory loss. We may walk into a room and say, why did I go in that room? Oh, but you may remember. That's normal memory loss. However, when it becomes progressively worse and interferes with daily life, there is a need for a medical evaluation. It is important that you are seeing a doctor, a neurologist that specializes in memory issues to get a full assessment to make sure and see what's going on with your memory. Next slide, please. I know we've all heard this. It was a huge campaign. Know your numbers. We all go to the doctor every year. We get our blood checks. We get our glucose level checks, etc. And we should know our numbers. Knowing your numbers will let you know how your health is going and if there is anything that you need to look out for. Well, I'm going to tell you that knowing your numbers, adding knowing your brain health numbers is very important. Next, please. So the process of knowing your numbers is we use the memory assessment. And the process is, in my clinic, I use the Montreal Cognitive Assessment. It usually takes about 20 minutes for me to administer. It's a one-on-one private session with the patient. And we look at several different domains of cognitive functioning: learning and memory, language, general intellect, attention and concentration, visuospatial skills, motor and sensory skills, speed of processing information, and orientation. So the benefits of getting this assessment is that it establishes your baseline for future reference to determine if there is decline over time. And depending on the results, it will let you know if further evaluation is needed. Next, please. It's also important to know that if you're having memory issues, sometimes dementia-like symptoms can be caused by other issues, such as vitamin B12 deficiency, medications, stress, anxiety, depression, hypothyroidism, just to name a few. These are known as a pseudo-dementia, and they are reversible and can be addressed with medical intervention. Next slide, please. So a few points that I want everyone to take away from my presentation. With or without memory issues, adults should have yearly memory assessments. If you or your loved one are experiencing memory issues, you need to be evaluated by a neurologist that specializes in memory. Call one of the memory disorder clinics. Next, please. Your brain is just like any other muscle in your body. If you don't use it, you can lose it. You should participate in regular cognitive exercises daily in order to promote good brain health. I want to thank you for listening to the information I provided about the Memory Disorder Clinic. I know the map came up really quick. I do believe that we will provide the information to everyone, but here is my contact information. If you're not in West Palm Beach, but you need to get information on the memory disorder clinics, please reach out to me and I can connect you with a coordinator in the county for the clinic that is closest to your area. Thank you.
Thanks so much, Dwan. That was outstanding.
Thank you.
Down to earth, comprehensive. We have a comment from Mrs. Jackie Alexander. Very good information, Ms. Clayton. Thank you.
Thank you.
And here's another one from Sabrina Cromarty. Are these services available in other counties such as Dade, Broward, or Leon?
Oh, yes, they are. We are across the state. Down in Miami-Dade County, I believe there are 3 clinics. Leon County, that's Tallahassee, correct?
Right.
Yes, Tallahassee Memorial Health. And Broward, that is the Broward North in Deerfield Beach. So we are all across the state.
Thank you. Sabrina also has an affirmation for you, Ms. Dwan. Excellent presentation. Are Medicare patients eligible for partially state-supported memory disorder clinics services?
Yes, they are. I know in my presentation, I spoke about memory assessments. Memory assessments coming into my clinic, and I believe most of the other clinics throughout the state, pre-COVID, we used to go into the community and we did free memory assessments. Now I'm doing a lot of free memory assessments via Zoom. Right now, if you're across the state, you give me a call, we can set up a time for you to do a free memory assessment. Once you come into the clinic and you have to see either our neurologist, neuropsychologist, or nurse practitioner, that is when your insurance would be billed.
Thank you, Mrs. Thomas, for that excellent question. Well, thank you so much, Dwan, for addressing some important questions and a very informative presentation.
Thank you.
And now we have our final panelist talking about culturally responsive, faith-integrated services, skills building and support services in particular for African American and others in the community who are looking for assistance. Welcome, Tamika Norton Brown.
Good evening, everyone. What I am going to do is to give information regarding our Acts 2 program. We know that we've told you all a lot about resources that are available, and our program is one program out of many that are available for you to take full advantage of. Next slide, please. As Dr. G said before, Acts 2 stands for African American Alzheimer's Caregiver Training and Support Program. I will say that although our 12-session program is for African American caregivers of loved ones with Alzheimer's or some other form of dementia, anyone who calls us, we will help in any way that we can and refer to other programs. Even if it's not our program, we will be a bridge to some of those other programs that have been mentioned. We are faith-based, which just means that we have woven in elements such as scripture reading, prayer, meditation into our actual 12 sessions, but our program is ecumenical, so anyone is available and eligible to participate. Here is the basic description of our program. Our program includes 7 group skills building, where there are 3 persons in a group and there are 5 individual sessions. And we have put 3 caregivers in a group so that the caregivers in the group get the benefit of knowing that they're not the only person who are having these difficulties, and they can share their experience with the other persons in the group. All sessions are delivered weekly over a toll-free telephone line by what we refer to as lay pastoral care facilitators. To participate in our program is absolutely free. So we use a free teleconferencing system, and the persons who deliver our actual 12-session program, the lay pastoral care facilitators, are just lay persons from the churches or from the community who have either seen a presentation and said, hey, I'm interested in leading those groups, or they are persons who have been nominated by their adjudicatory leaders, and we take them through about 36 hours worth of training before they are actually put over an actual group. On the individual sessions that the caregivers receive with the facilitators, it's going to focus on any goal setting or problem solving that concerns that the caregivers have identified when they come into the program. This is very important because a lot of the time, so much of the focus is put on the loved one with the dementia, and people seem to forget that there's a whole person behind the scene who is taking them to the doctor's appointments and giving them medications and doing the bathing. And these caregivers come in with concerns. Some of them are caregiving related goals, and some of them are personal goals. So we really dedicate 5 sessions to them where they get to work one-on-one with that facilitator on those goals. Next slide, please. Here are the basic contents of our skill building modules. We have 6 major components. The first is the overview of the basic characteristics or dementias, or I call it Dementia 101. There's also relaxation training that's combined with calming prayer and or meditation. There's this entire myth that relaxing just means going home, kicking off your shoes, and getting in your favorite chair, when in actuality, there is an entire process of teaching and training your mind to enter into a relaxed space. You calm your mind, you calm your body, you calm your spirit, and that is how you relax. So we actually train our caregivers on how to actually relax. There is effective thinking about the challenges of caregiving coupled with scripture. Effective thinking just means we want you to change the way that you think about your caregiving situation. Next slide, please. We have, which is my favorite, building in pleasant daily activities, such things as like taking 15 minutes to take a walk or listening to your favorite gospel music. I refer to this as the me time module. We also have communicating effectively with the care partner with dementia, with family and health professionals. We know that sometimes as caregivers, we can get, and I say we because I've done it, we can get so overwhelmed by everything else that our communication starts to break down. So we will teach our caregivers how to communicate effectively so they can get their needs and their points across to family and other health professionals. And then we have what I spoke about earlier, developing effective problem solving skills through personal goal setting. Next slide, please. Okay, and here are some additional resources that we've listed for you. We have the Alzheimer's Association. Go back one slide, please. Okay, we have the Alzheimer's Association, the Alzheimer's Foundation of America, the Florida Department of Elder Affairs, the Elder Helpline, the Elder Care Locator, and the Alzheimer's Disease Education and Referral Center. Next slide, please. Okay, how can you contact X2? Several ways that you can contact us. One of the ways is by our Facebook page that you're on right now. You can send a message and we will respond to those messages. I know I've interacted with several of you today through the message on our Facebook page. We have a toll-free number. That number is 1-866-778-2724. That number rolls to my local cell phone number. That number is 850-274-4945, or we have my email address, which is tnnorton@fsu.edu. We also have a website, which we're going to bring up so that you will be able to see what our website looks like. If you bring up the website, please. Okay. On our website, if you will go to links. Okay. On this page of useful links, we have links to resources that are available not only in the state of Florida, but we have national resources listed as well. If you will go back up and click on Caregiver Resources. On our Caregiver Resources page, we have included things like prayers and readings, like a caregiver's prayer and the Serenity Prayer. We also have fact sheets and other information on the basics of dementia, and there's also caregiving skills related information and links there as well. If you will go back up to Donate, please. Okay, we are primarily funded by grants and investments from the faith community and private donors. If you would like to get more information on how to donate to X2, you can find that information on our website as well. And finally, if you will go back up and click on Sign Up. Okay, here is our contact and sign up page. You can fill out the information on this form. Even if you just have a question, fill that on this form. This form does come to my email address, and I do respond to those requests for information, or if a caregiver is interested in the program, we will make sure that we respond to all of those requests for information that we have. What we are now going to do is we're going to bring up the full panel to address some of the questions that you all asked earlier.
All right. Well, that was one powerful set of presentations. For those of you who did not register and would like to receive the PowerPoints, we can email them to you. There are two ways to do that. After the workshop is completed, there'll be a video, and underneath that video, in the video workshop description, you will be able to click a link to get the an email of all of the presentations that were made today. You can also email Tamika Norton Brown, who is, of course, our last speaker, at TN Norton, Norton, TNNORTON at FSU.edu. And you will get the entire package free of charge. Ms. Demps, Hope Demps, we thank you for your feedback. Same for you, Ms. Cromartie. Thank you so much for your positive affirmation. Chris Scobie has indicated if someone was denied 5 years ago, can they be reevaluated with increased memory problems? I assume that is reevaluated for services. That's my intuition. Would Lisa or Marissa would you like to comment on that?
I'm going to toss that to Marissa.
Sure. Someone can be reevaluated the next day. If they do a screening one day, they fall the next day and have more issues, ailments with memory or whatever it is, they can be reevaluated at any time.
Thank you, Ms. Henderson. Sandra Thomas has two questions that she gets asked often. Can a caregiver receive a monetary allotment monthly for caring for their loved one? And how would they go about applying for this, assuming that they can receive the allotment?
So, Marissa, this is one of those programs that you also help with.
Yes. Yes. I
You're
got
popular, Marissa, aren't you?
it. Yes. So there's two programs that can be, it's often referred to as the caregiver stipend, people normally say, but there's two programs that we have that address that. And one of them is the home care for the elderly, that's HCE program, and both of them, and the long-term care program that I talked about, both of them have the income and asset guidelines are the same. And so those are the two programs for the monthly stipend. The HCE program does $160 per month for the caregiver, and the Medicaid long-term care program can do the amounts of paying for the services. So they may get like $15 an hour or however much the services cost for that caregiver.
Home Debs has another question or comment. My father and I help with my mother. Would we be the same for the Acts 2 group, Tamika?
What we typically do is we train one caregiver per loved one. But if you all are in the same household or if you all are sharing those duties, you are more than welcome to share any materials that we provide with you for your father. But we train one caregiver per loved one.
Monique Carter has a question. How can an agency contract with you or any of your programs to provide home care assistance?
Okay, I'll take that one. If you reach out to your elder helpline, they will connect you to what we call lead agencies. Area agencies, aging and disability resource centers do not provide direct care. We have subcontractors in the community that provide those direct services. So we would refer you to contacts within the counties you're inquiring about.
Thank you, Mrs. Bretz. Now we have a question from Jane Springer. Actually, an affirmation. So much great information. Thank you. Thank you, Jane. Sandra Thomas has an affirmation. Thank you. I didn't know this service was available. Well, that's why we're here, because we want you to know what's available in your state for memory services, for long-term care, and for other aspects of caregiving. Thank you, Dr. Richard. We appreciate your your little shout out to Dwan, your sorority sister. Chris has another question. Is there any support for children who live with people diagnosed with dementia?
I guess it depends on the type of support you're referencing. Is there education to help them understand how to, assist the individual living with dementia and make sure that they still feel that they're part of that family unit? To being the respite care or not respite care, the care partner that participates in these programs we talked about. So either calling the elder helpline or reaching out to your memory disorder clinic would be the best way to find out what types of services and supports are available in your community.
Thank you, Chris, for your question. Do you work with the VA? Veterans Administration? Mrs. Brett?
We use them as a referral source, and through the conversations that Marissa's staff might have with people, Depending on what type of income sources they have, it may require her to suggest they get certain documents from the VA or seek assistance from the VA if there's a benefit package that could be better suited for their needs than through the statewide Medicaid managed long-term care program. An individual cannot participate in the VA home and community-based service program and the state Medicaid waiver program. So that is part of the counseling that her staff conducts.
Ms. Clayton, do you have any comments about VA collaboration?
Yes, we have collaborated with the VA. A lot of our services, kind of like what Lisa said, that, services out in the community, we're not providing those direct services, but I have worked with the VA as it relates to patients that are suffering from memory issues, working with those social workers over at the VA. Sometimes we're having to kind of share information as it relates to if they need to come into the clinic to see a neuropsychologist or even see our neurologist because they could not or did not get a lot of the services at the VA, because when they're coming over to us, especially getting those memory assessments that I spoke about, they're absolutely free. So I have kind of worked with a few of the social workers at the VA to kind of get people in and get those assessments completed.
Thank you. That's very helpful information. We have a comment, I think some questions from Hope Demps. Does gross income limit apply to both in one of a married couple who needs long-term Medicaid help? If someone makes little gross monthly income, will that count if the other makes more?
Okay,
Is that a
I'll take
Marissa
that.
question?
It is. So the income limit is for individuals. Only if both are applying is when both will be counted. So if there's there could be someone in the home making $60,000 a year and their loved one is the only one applying, their income is not going to be counted. Just that one that is applying will count.
Thank you, Marissa. Very helpful response. Other questions? Well, here's an affirmation from Ms. Cromartie. Excellent presentations and valuable information from all you ladies. Thank you, Mr. Scobie. Appreciate your affirmation. Okay, well, we're kind of rounding the bend here. We would like to ask each of the panelists, if you feel led to provide a final thought, and then I'll have some parting comments for you. Who would like to begin? Thank you, Ms. Bretz.
I just wanted to go back to my presentation and explain that those services may not be directed towards the individual living with dementia. Often we have households where we have an older spouse caring for their older loved one that's living with dementia. And so performing those daily tasks can be a burden. We want people to be able to focus on their loved one and not the burdens that they feel they need to carry. So we really do encourage people to reach out to the Elder Helpline. These services are in existence to help you, and our programs are they save the state money versus nursing home care. So we really want to be able to be sure people understand the whole gamut and array of services when we talk about home and community-based service networks.
Thank you.
I guess I'll go next. My final thought from the Memory Disorder Clinic is that, one, we're located all across the state. If you all aren't sure, just give us a call. The biggest thing that I want to just press upon everyone is that don't wait until your loved one or even yourself have really developed a lot of memory issues and is starting to affect your activities of daily living. We want to get you assessed as soon as possible, and any type of prevention that we can implement into your life, that's what we want to do. So don't wait, give us a call. And as I stated, with my information, if you cannot locate a clinic in your area, I can get you linked up to someone that is in your area. And thank you all for having me again.
Thank you, Dwan Clayton.
Okay. I just wanted to encourage everybody, even if you feel like you don't qualify for Medicaid or any of the programs that we have, go ahead and call us. Let us educate you on that. And the Elder Helpline phone number is a statewide number. So wherever you are in the state, you call that number, it's going to direct you to your Aging and Disability Resource Center in your area.
Very helpful statement. Tamika Norton Brown?
The only thing I will add, I agree with everything that the lady said. And from a personal standpoint, scripture says that people perish because of the lack of knowledge. So we are providing information that you all can take and use. The resources are there. The resources are available for you. There is no shame. There is no dishonor in calling and saying, hey, what do we qualify for? There are a lot of things that are available that I'm still learning about. So if you don't know where to start, use our toll-free number as a starting point. Call the Elder Helpline as a starting point. Take the first step. And if you don't know where to go, we will point you to people who will help you to help you go on this journey. So please, I'm just imploring everyone, take advantage of the resources that are available. I know in working with these ladies, there are no silly questions. There's no question that we are afraid to answer. So if you don't know, arm yourself with as much education as possible so that you can take the best care of not only your loved one, but of you as well.
Laura Copeland has a response. Sounds like an affirmation. This was a fantastic workshop with great information. Thank you for putting this on and for all that you ladies and Acts 2 staff have done. Thank you, Laura Copeland. Dorothy Ingraham, we'll be calling. Thank you, everyone. Marlisha Minute, thank you for all your information, or Minette. I'm sorry, probably Minette. A thank you from Sandra Thomas. Monique Carter. And from Julie Menendez, love all these MSW ladies. Social work power.
In Social Work Month, yay.
All right. Thank you for joining us. Just an important thought, I believe, is this is not the end of the dialogue, folks. Please put your questions and comments in our Facebook site. And if you have individual items you want us to send to Lisa Bretz, Dwan Clayton, Marissa Henderson, or of course, Tamika Norton Brown, we will get that information to them. So that's one outlet. You can also email Tamika Norton Brown, who will be a conduit for email related questions at tnnorton, TNNORTON at fsu.edu. Sorry for being repetitive, but I just wanted to let you know this is not the end of the dialogue. Please call each of these individuals or email. They have given their contact information to you through documents, and you can access them directly if you wish. They want to hear from you and can lead you to other resources that you may need or want to have available. The last statement is that I wanted to let you know that this is a monthly series that we're offering. We will be doing this next month. So in the month of April, we are going to focus on Floridian-based day services for older adults with dementia. That will include adult daycare, senior centers, attendant care across the state. So we will be speaking to you about those issues. I know some of you are not able to access those services due to COVID, But we're going to address that issue, but we're also going to help you to prepare for the future, because this pandemic is going to end by God's grace, and you will potentially be in an in-person situation and where you're wondering which daycare is most appropriate, which are the daycares that work best for your loved one with dementia, what kinds of attendant care services are available, whether it's through the state or privately, and then senior centers who provide activities for loved ones with dementia throughout the state. So thank you. What a great blessing to reach out to this wonderful audience. Thank you for to the social work, and then Miss Tamika Norton Brown, project coordinator, for your outstanding presentations. And most of all, we thank you folks for being with us this evening and contributing your thoughts and affirmations. Thank you, Rosa Cambridge. So for now, we'll say goodbye, and we'll see you next month. Please be on the lookout for the exact date of that day's services workshop on our Facebook site, Acts 2 Caregiver Project. Have a blessed evening, folks.